China wanted to show off its vaccines. China's coronavirus vaccines were supposed to deliver a geopolitical win that showcased the country's scientific prowess and generosity. Instead, in some places, they have set off a backlash. Officials in Brazil and Turkey have complained that Chinese companies have been slow to ship the doses and ingredients. Disclosures about the Chinese vaccines have been slow and spotty. The few announcements that have trickled out suggest that China's vaccines, while considered effective, cannot stop the virus as well as those developed by Pfizer and Moderna. In the Philippines, some lawmakers have criticized the government's decision to buy a vaccine made by a Chinese company, Sinovac. Officials in Malaysia and Singapore, which both ordered doses from Sinovac, have had to reassure their citizens that they would approve a vaccine only if it had been proved safe and effective. At least 24 countries, most of them low and middle income, signed deals with the Chinese vaccine companies because they offered access when richer nations had claimed most of the doses made by Pfizer and Moderna. But the delays in getting the Chinese vaccines and the fact that the vaccines are less effective mean that those countries may take longer to vanquish the virus. Beijing officials who had hoped the vaccines would burnish China's global reputation are now on the defensive. State media has started a misinformation campaign against the American vaccines, questioning the safety of the Pfizer and Moderna shots and promoting the Chinese vaccines as a better alternative. It has also distributed online videos that have been shared by the anti-vaccine movement in the United States. China had hoped its vaccines would prove it had become a scientific and diplomatic powerhouse. It remains on par with the United States in the number of vaccines approved for emergency use or in late-stage trials. Sinopharm, a state-owned vaccine maker, and Sinovac have said they can produce up to a combined 2 billion doses this year, making them essential to the global fight against the coronavirus. Unlike the Pfizer and Moderna vaccines, their doses can be kept at refrigerated temperatures and are more easily transported, making them appealing to the developing world. They have been doled out as aid to countries like Pakistan and the Philippines. Many people have memories of the country's vaccine scandals. Several governments remain angry about Beijing's lack of openness about the virus in the early days of the pandemic. Its efforts at the start of last year to distribute masks and protective equipment to the West came under fire amid reports of shoddy quality and the demands by Chinese officials for public thanks. Countries like Turkey and Brazil are rolling out their immunization programs with a Sinovac vaccine because Western companies cannot deliver as quickly. But Brazil's efforts have been delayed as well. Eduardo Pozzuelo, the country's health minister, said China was not acting fast enough with the documents needed to export raw materials to Brazil. The world was also caught off guard by the disclosure that the Sinovac vaccine may not be as effective as previously thought. Earlier, officials in Turkey said trials there showed the vaccine had a 91% efficacy rate. In Indonesia, it was 68%. In Brazil, researchers initially said its efficacy was 78%. Scientists said it had an efficacy rate of just over 50%, once people who experienced mild symptoms were included. That level is a hair above the threshold set by the World Health Organization to consider a vaccine effective. In a news conference last week, Sinovac's chief executive officer, Yen Wei-dong, reiterated that the vaccine was 100% effective in preventing severe cases. He said the lower efficacy rate was a result of the trial's focus on healthcare workers, who had a higher propensity of contracting COVID-19 than the general population. To be sure, the Chinese vaccines have a big appeal to many countries. More than 40 countries have expressed an interest in importing Chinese vaccines, according to China's foreign ministry. Several world leaders, including President Recep Tayyip Erdogan of Turkey and President Joko Widodo of Indonesia, have gotten a Sinovac vaccine. Masks act as barriers that block the flight of virus-laden droplets. We should all assume we might be an asymptomatic virus spreader, so we should all wear a mask in public spaces. By wearing masks, we can reduce the risk of spreading the virus, and that will help protect our collective health.